how's it going? Are you Mariano?
Yep, that's me.
All right, how's it going?
Good.
I'm Tyler. I'm a student of physical therapy under the direction of Dr. Wright, and so I'll be treating you today. Yep. I see that you came in with a sling. Can you tell me a little bit about what happened?
Well, I was walking home after a game the other night, and I played baseball, and I was trying to cross the street. I thought the drivers were going to stop at the stop sign. Fortunately, they didn't. They kind of like saw me and started hitting their brakes, but then it was too late by then, and then I got thrown about 10 feet, so I'm told. And I went to the hospital and stayed there for 3 days, and now I am here seeing you.
Oh man, you really can't trust those Utah drivers.
No, you can't.
So, I mean, you said that you were told that you were thrown 10 feet. Do you remember most of your accident?
I mean, I remember brakes squealing. I didn't really go unconscious, but it's just like kind of all happened really fast. I got hit really hard.
Okay. So with that, anything besides, I mean, I see obviously you're in the sling, but anything besides your arm?
Yeah, I mean, I have my arm is fractured. They just did surgery to fix it. I'm able to move here, and I'm able to move my elbow. They say I just need to protect this. And then my lower, mid to lower back, there's a few vertebrae that have fractures, so I'm wearing a brace for that. And then I have some rib fractures as well, which makes it like kind of difficult to breathe. Just like trying to do anything strenuous. I feel like I'm working really hard to take small breaths and like not overstrain my ribs.
Okay. So I see on your intake form from your doctor though that I am allowed to remove that sling and that splint to do some therapy today. Have you been taking those on and off at all?
Only when I'm laying in bed. That's when I take both off. So otherwise I'm in those pretty much all day.
Okay. Have you been having any sort of dizziness lately at all?
No, not that. I mean, nothing crazy. If I stand up too quickly or something, yeah. But I mean, that probably happens to you if you stand up too quickly. So.
Okay. Yeah, it definitely does. Any sort of vision changes at all?
No. Not that I can say.
Have you had any like numbness or tingling in your hands at all?
No. This just hurts. Like, it doesn't have like a weird tingly or anything like that.
Okay. So you said you play baseball, so what is your kind of like home situation like? Are you living with, I see that you have your buddy Ben over here.
Yeah, I'm living with my roommate currently.
But like as far as house setup, you know, are you able to maneuver around that? Is there any difficulties at all?
Yeah, I mean, I have to walk up some steps to get into my apartment, but that hasn't really been a problem too much other than just being kind of like out of breath at the top, just because my ribs hurt. But other than that, I just do a lot of laying in bed all day. I don't really, I mean, we have online classes, thank God, so like I just kind of turn my Zoom meetings on and chill out all day, which, I don't know, seems to be helping kind of, but then whenever I stand up and start moving around, it starts hurting, so it's really hard to say.
Do you get a lot of pain with sitting there all day, or do you feel like...
No, I feel pretty much my best when I'm just like laying and just like not moving at all. That's when I don't have any pain.
Okay.
Which is
yeah,
not great.
It's not great, but we'll try to help you with that. Other than school and baseball, anything else throughout your day that this is really, I mean, infringing on?
I mean, I'm able to do school pretty well just because you don't have to do a lot right now. But I do want to get back to baseball. I would like to be able to swing a bat again. It's really important to me. So
okay. So we kind of already talked about things that kind of make your symptoms worse. You talked about really any movement in general, and then you get a little bit of fatigue going up your stairs. Is there any other big things that kind of make your symptoms worse or cause pain in the arm?
It's just moving. It's just, I mean, obviously they're broken, so it's really tough to not hurt when you're moving. But yeah.
So if you had to put in order, it'd be that pain is number one, and then kind of that fatigue, that deconditioned state's number two, as far as...
Pretty much, yeah. But I mean, I understand. I mean, the surgeons kind of told me, like, it's not going to feel great, you know? So, I mean, whatever I can do in here to get something better is worth it, I feel like.
Okay. And then So we kind of talked about things that make your symptoms worse, and then kind of mentioned just staying in that still position kind of helps it out. Is there anything else that kind of helps you out with like relieving symptoms at all?
I'll put like an ice pack or something on my arm every once in a while, just to try to numb it up a little
The college athlete try.
Yeah.
Rest and ice, baby.
Yeah.
I'm sure you have athletic trainers tell you that as
Yep.
well.
And ibuprofen.
Okay, so so that was my next question. Have you been taking any medications?
Yeah, they gave me pain medication after my surgery, and then I'm about to be out of that, and I just take ibuprofen. I mean, it kind of helps, but I mean, it's not the best.
I understand. Okay, anything that your doctor instructed you on as far as precautions for the surgery?
I'm just keeping my arm in my sling.
Okay.
When I'm not like in therapy, that's about it.
Okay.
Really, and like keeping my brace on until those fractures heal up, and then I can take it off basically just when I'm laying down at night.
Okay.
So that's it.
All right. That's pretty accurate with everything that he told me. I just wanted to make sure that you had an understanding of, kind of what's going on as well.
Yeah.
All right, so we're gonna get into some of the physical examination now. And in order for me to do that, I am going to be placing my hands on various parts of your body, including, shoulder, elbow, wrist, hand, all those, low back, and really anywhere that you're feeling affected, I'm probably going to be checking it out today. Is that something that you're okay with?
Yeah, that's fine.
All right. First thing I'm going to do, though, is I'm going to throw on this gait belt, just because this is my first time seeing you, and I do not know how you're going to be moving around and what has been affected after that, the accident that happened. I'm just going to slip this over you here. Let me know if that is too tight on you. Okay. How you feeling? You ready to stand up? We're gonna stand up first, okay?
Alright.
You can leave your sling on. How's that feel? Any pain at all?
Doesn't feel good on my back, I'll be honest with you, but
Okay.
it's not.
Well, this is something I want to work on then, is just your standing tolerance, okay? But I'm gonna look at some motion, so if you could look up for a second. Well, not look all the way up, just straight forward at the wall ahead of you. You doing all right?
Mm-hmm.
Okay. Any tenderness through here?
Right through there. Starting there,
Okay.
then down, and then goes away.
Okay. All right. Still doing all right?
Mm-hmm.
So at any point, if any of these movements kind of flare up your symptoms, and it's similar to what you're coming in with, please let me know. Okay.
Okay.
I'll repeat that question multiple times. I'll sound like a broken record, but this is important for my initial exam. Okay. So the first thing I want you to do is try to bend over and touch your toes. No? All right, that's fine.
I don't.
And then can you go backwards at all?
Not really.
All right.
Not with my brace on, at least.
Okay. So the next one I'm gonna have you do is look at me, and then look all the way up, and then look down, and then look over your left shoulder, look over your right, and then look back at me, and then go one side to the edge, other way. Any problems with any of those?
Oh, not really.
Okay. Next thing I'm gonna have you do is take your right arm and go all the way up. No problem?
I mean, it hurts my ribs
Okay.
a little bit. Right here.
Right
It
there.
starts hurting, yeah.
Okay. And then out to the side.
That just doesn't feel good here.
Okay. And then what about at like a diagonal?
Still not great.
Okay. So next thing I'm gonna do is actually slip this sling off and slip the splint off. I bet it feels good to have that thing breathe.
Yeah, a little stinky, but
Yeah. Okay. So same thing with that left arm is as much as you can. Just show me as far as over the top you can.
that's
Okay.
this is about where we're at there.
Okay. What about out to the side? Okay.
That one's kind of just like a mixture of like my wrist hurt and then like my arm kind of doesn't feel very good
Alright.
either.
And then what about that diagonal? Same thing, just pain.
Yeah,
Pain and
say.
ribs.
Doesn't feel like anything's like wrong. It just doesn't feel good to be past here.
Okay. You still doing okay standing up?
Yeah, I mean, my back doesn't feel awesome, but what are you gonna do? You know?
Yeah.
All right. So we can actually sit down now. Kind of got an assessment. I mean, I made you stand up there for about 2 minutes,
Yeah.
so I know that you're pretty independent in standing, and I'm not gonna worry about you falling. So that's always good.
Yeah.
All right. So the next thing I am going to do is just kind of look at your eye movements really quick. So what I want you to do is look at the tip of this cap here and just follow it. So try to keep your head still. And follow the pen, not move your head. Those look great. Okay, so moving on. If you're comfortable, would you like to leave the gate ball on? I'm gonna have you lay back down so I can look at some of your movements.
Are we gonna use it later?
We are gonna use it later,
Okay.
but
keep on.
before we use it later, I am gonna have you lay on your stomach, and so I don't know how comfortable that will be. That belt buckle on your stomach.
That's okay. I
All right.
really don't mind.
Okay, so you lay back down on your back, please. I'm just going to look at some of the motions in your arm and your lower body. Okay. So once again, at any point, if any of these movements bring on any of your symptoms that are familiar to what you're coming in with, please let me know. Okay. So if you could bring this heel towards your right buttock, please. You getting pain right there?
Yeah.
And then what if I help you out a little bit more?
Yeah.
Okay. $100, and then if you do that by yourself again, I'm not going to help you out. So just bring that heel to your butt. Okay. 85. So the next thing I'm gonna have you do is try to bring this leg up as far as you can, right there.
Doesn't feel very good.
Where's that pain at?
It's just in my lower back.
Low back. Okay. Same one side, middle.
Just both sides. Just doesn't feel very good.
Okay. Goes about there. Take a look at your arm now.
It still doesn't feel very good on my ribs though.
Okay. What'd you say about there?
Yeah.
Alright. Doing alright?
Mm-hmm.
So just take you into end range here. Okay. Those are looking good. Alright, you can put that, you can rest that. So if you could bring your left heel to your buttocks now.
Yeah, that doesn't feel great.
That's about the same as your other side. Once again, let me know right there. It was about there that you were painful?
Mm-hmm.
Okay. About the same as your right?
Yeah.
Next thing I'm gonna do is look at your arm motion. So once again, let me know when you get in pain.
there.
Yeah.
Okay. How you feeling?
Fine. Ouch.
Okay. Right there?
Yeah.
Okay. Got to about 45, so that's good. Gives us something to work on.
Okay.
So, going from there, how do you feel about getting onto your stomach? Would you rather have me I could do most of the stuff with you standing up? We're gonna have to
I
stand
really
up again.
prefer to do that because I don't really like rolling around.
Okay, that's fine.
Yeah.
So the next thing that we're gonna move into is I'll talk you through it first, and you can kind of watch me before we're getting into it. So we're getting into some outcome measures. So the first one is a 5-time sit to stand. Can you tell me what you think that might include?
I bet I sit up and stand like 5 times.
Sweet. So
Or
yep,
6.
5 times. It's in the name, but you almost got it.
6 times 6 to stand is a tongue twister.
Yeah, it is. So for this one, you are gonna be in this nice wooden chair over here. That's sturdy.
Okay.
You don't have to sit up yet.
Okay.
If you want to just relax and listen for now. So this is kind of just looking at that fatigue that you have. So I know that's been a big thing for you, and it'll kind of get to show us kind of a little bit of progress with some of your symptoms as well throughout treatment. So what you're gonna do, sit here, nice base support. You can use your hands if you want. It's just all noted. You're gonna stand up and sit down, like you said, 5 times, not 6. Okay.
Not 6. All right.
You need any help getting up?
I can probably do it.
I'm here if you need help. I'm just supporting your back a little bit. Was that a Jimmy Pop or a
Jimmy Pops, yeah.
Okay. All right. And so the test is over when you're sitting back down in the chair and your back is against the back of the chair after your 5 up and downs, okay?
Okay.
So whenever you're ready, I've got the clock on the wall and I'm watching it. All right.
Oh.
1, 2, 3, 4. Last one. Sit back down. All right, and time. How'd that feel?
My ribs are not feeling very good after that.
Okay. Well, your quads look like they're popping. Who's the strength coach over there now?
His name's Tyler. He's a funny guy. He knows what he's doing
He probably makes you hit the leg extension machine.
every day.
Yeah.
Mm-hmm.
You learned that from Dr. Paul Stoneman.
Yeah.
Okay. So your ribs not feeling fine. Is that more of just like you feel limited in your air intake?
Yeah.
All right. So we're gonna try something out then.
Okay.
It's called stacked breathing. I'll just give them a little bit more room here for our fun activities that I have planned for you today. And so I'll demonstrate it first or kind of explain it. So this is just really trying to get more air into your lungs, help you out a little bit better with, that fatigue, a little bit more energy going on, okay? So what you're gonna do, small breath in, hold it, 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 then blow like you're blowing through a straw. Okay. So for this next one though, we're gonna really focus on the small stacked breaths going through your stomach here. So like right here, okay? We really wanna get that air into that power belly.
Okay.
Okay, so we're gonna do that again. So small breath in, into here. Another one, another one, another one. And then once you feel, let that out. How'd you feel after that?
Pretty good actually. That didn't hurt my lungs nearly as much.
Okay, so that's something that we can add in to your treatment, okay? And then that we can add into the set of exercises that I'm gonna send you home with. So the next thing that we're gonna do is called the 10-meter walk. And so it's very similar, it's the same kind of fatigue test, but it's also looking at your gait. That's something that your doctor wrote on his note to me. is that he really wants me to look at your gait and see anything that is kind of affected by the accident that you were involved in. So for that one, there's going to be 4 different time tests, or not tests, but 4 different time trials, as you'd like to call them. So the first 2 are at a comfortable speed, and then the second 2 are at a fast, kind of like a brisk walk. But I still want you to be comfortable, okay?
Okay.
And so I've already tested your balance, and you seem to be moving pretty well. But I am going to be about half a step behind you, kind of encouraging pace and for safety, okay? And so for these, you are going to stand up. We don't really care about that stand. So if you want to just stand up, how that feel?
Good.
And we can do, if you want to, depending on how fatigued you are, in between the things, we can do that stacked breathing exercise, okay? But then I'm gonna leave that up to you. But we are gonna do these. So first 2, comfortable pace, you're gonna walk down the end of the room and back. How'd that feel? Do you wanna go through that stacked breathing, or are you feeling all right?
I feel fine right now.
Okay. So we'll do the second comfortable. Still doing all right?
Honestly, I'm doing okay.
Okay, so when you are ready, we're gonna do that kind of, that brisk walk, that comfortable fast walk. Is that a starting position? I didn't know you were in track, but you also.
In high school.
Okay.
Alright, ready?
Yep.
Might be able to keep up.
I'll be half step behind. How you feeling? Do you want to do that stack breathing? Would you like to sit down, or you want to do it standing up? Oh, it seems like you already started. All right, you can just go for it.
I gotta say that's a lot better than trying to just breathe with my ribs.
Okay, that's good.
I don't know how else to say that.
Yeah.
Breathe with ribs.
Breathe with the ribs. That's perfectly fine. I understand what you're talking about. You understand what you're talking about.
I counted 3. I got one more.
Yep. I didn't know you were a scholar athlete.
Yeah, I can count. Alright.
Yep. Okay. How you doing?
Oh shit.
You're gonna sit down? All right, so your gait looks pretty well. Not great, just well. You are having some limitations, and we noticed that I expected that with some of the motions that you were lifting in your lower extremities. But I am seeing also some limitations as well in your arm swing as well, just because of probably most likely your ribs.
It doesn't feel very good to move. Anyway.
These are all things that we can work on moving forward, and I'm sure we'll get teased out through treating some of the other things that you're coming in for. If you want, you can do another round of that stacked breathing.
I think I'm alright right now. I'm just
Okay.
sitting down.
All right, so from here we're gonna move on to some interventions. Would you like to do the fun intervention that's gonna fatigue you a little bit first? And do the, all right, you don't even want to hear the options, you're just, all right.
I'll just do that.
Okay, so if you wanna watch, you feel safe here?
This is the most tiresome.
Yeah, we're gonna do the most tiresome first, is that,
Let's get it out of the way.
that's what you agreed on, so patience always
I agree.
right. So what we're gonna do, there is a box here, but although it is not sturdy enough for what I would like it to do, we're gonna work on just some toe tapping here to imitate a step up exercise because of his fatigue and that he has stairs to get into his house. So what I'm gonna have you do, we're gonna do 10 steps each side, okay? So up, tap, down, up, tap, down. You think you got that? Pretty easy?
Yep.
Uh-oh.
It's also done.
Okay. So when our order of steps come in, what we're gonna do is full steps on the thing. We're gonna work on that up to a minute on each side. Okay, you got 6 more. 5, 4, 3, 2, 1. Relax. How's that feel?
Tired.
Tired? Do you want to do a round of that stack breathing, or do you want to just lay down and get on with other interventions? Oh, going for the stack breathing already. I see you take a liking to that.
Yeah, that's good. I like that.
Okay. You ready to lay back down and get into some of the other stuff?
My back kind of hurts. Can I just sit?
Um,
Before I lay back down.
You can sit. That's perfectly fine as well. All these things that I'm kind of sending you home with, besides that step up, are things that you're going to be able to do either laying down on your back or sitting.
Okay.
So the first one I'm going to do is a little forearm series. If you've got a hammer at home, water bottle, weighted stick, I don't know, you could go find a stick outside, put a couple rocks, wrap it up with athletic tape. You know, you're a baseball player, go get creative. So first thing I'm gonna have you do is just rest that forearm on this thigh. And you're gonna go back and forth, nice, slow. Big motions are good. If the weight is too heavy, just choke up like you choke up on a bat and go back and forth, okay? How's that feeling?
It's hard, but it's good.
Doable?
Doable.
Okay, let's move on to the next one. Next one, you're gonna have your thumb kind of pointing forward. You're just gonna go down, up, down, up. Okay, that one's straightforward as well.
Yeah.
Next one, you're gonna go hanging off kind of the side, and you're gonna just pull it back. So if you go out here, good. So once again, those are ones that I want you to do at home. As long as with this next one, I'm sure you have a stick, a golf club, a baseball bat laying around. So you're just gonna mirror me basically once I give you this. So this hand is gonna be gripping this nice handle here, while this hand is flat against the end, and you're just gonna push out, okay? So make sure to try to keep that elbow tucked at your side. Does that feel alright?
Mm-hmm.
Okay. Next one, same thing, but you're gonna grasp the end of this one, yep. You're gonna pull with that arm. You're a natural. What?
I'm tired.
Third time's a charm. Alright, so this next one, we're actually gonna go, same thing, grasp the end with that. You're gonna hold here, rotate your hand here, and you're gonna move your arm out, kind of like a swinging motion. So once again, I want you to go right before the pain shows up. Little discomfort's fine.
Yeah.
I don't want to put you, feeling like you have to take a bunch of ibuprofen after you see me or do these.
Okay.
Okay, so same thing. Now you're gonna go up. You understand that one?
Mm-hmm.
All right. So now we don't need the cane stick, and we're gonna work on a little bit of that. Yeah, stick's a little bit dirty. Sorry about that. Now we're gonna work on. So we worked on that thing above. Now we're gonna work on the thing below. Before working on the thing in the middle. Okay? So we're gonna go here, and you're just gonna, doesn't matter how you do this, just try to bring your fingers back. Kind of get a little stretch, and then come back. A little stretch, relax. Stretch, relax. You're a good student. What do you think comes next? Great. We're gonna go down.
One other option.
Yep,
Or
same
maybe.
thing. Stretch down, relax. Stretch down, relax. Stretch down, relax. Good? Okay. Which other ways do the hand move? Yeah. So next one we're gonna do, pulling your pinky down towards the outside or inside. Doesn't matter which one you go first. Sorry, I have my hand up and facing, the back of my hand facing the way. Good. Hold down and relax. Okay. And then that last one, just pushing away. Yeah, it's a little bit easier if you can rotate your arm and pull it towards you. Is that pretty straightforward? Last one we are gonna do is for your elbow.
Okay.
And so this one's what I'm expecting to have the most limitations just because of the surgery that you're in for. So what I want you to do, sorry, you're just mirroring me, grabbing around that wrist area of your other one and just pulling and pushing up. How does that feel?
That's fine. Kind of tight.
Okay. So for those exercises, so we have 4 total that we did today technically. So we had that stack breathing. You remember that one? Okay. We had those step ups. We had the forearm exercises. And then we had the range of motion stuff, kind of getting that stiffness out of your shoulders, kind of freeing you up a little bit. You remember all those?
Yeah.
Okay. So what I want you to do is those are also going to be your home exercises. And so with
You
that,
write those down.
yeah, I was gonna ask you if you wanted like a physical paper copy with all the instructions, or you wanted links. I can do both.
Paper's good. I
Paper's
like
good?
paper.
Okay. So with that, I mean, you also have my contact info. So anytime if you lose that paper, feel free, shoot me a text, email, call me. I'll send you those links. Those are very important to your rehab. And so, when do I see you next? Today's
Monday?
Friday, and you're scheduled like I think 3 times a week. So yeah, Monday, that makes sense. So over the weekend, I want you to do Saturday, Sunday. I want you to do in the morning. I want you to do all those exercises. At night, I want you to do all those exercises both days. On Monday, when you come in, you don't have to worry about doing those home exercises. You're gonna come in, do them in the clinic. We're gonna look at them. We're gonna adjust. We're gonna modify. See how you're doing with those. See how you're presenting. Does that make sense to you?
Yeah.
Okay. Do you have any other questions for me?
No.
Does your friend Ben have any other questions? I would, Ben, really appreciate you if when he is doing those step ups at home that you are next to him, or if Ben is not home, try doing it next to like a counter that you can grasp on.
He's coming to therapy too, so he'll learn everything here. So hope
Ben,
you're paying attention, Ben.
Ben, this wouldn't hurt. Also, if you do these at home, I know you're a baseball player as well. All these exercises that I gave him are very good and for arm health as well as sport specific. So you could do them if you want to and make it a little bit more enjoyable. You could do it with your good friend Mariano here. I think it would help him a lot greatly. And if he was a good friend, he would do them with you. With that, I will see you on Monday, and I'll send you out with that paper of your home exercises.
Okay, Doc. Thanks.